I'd like to introduce Una. Una is a postdoc mental health researcher and former researcher at the Pro, specialising in using lived experience voices to help improve our understanding of eating disorders. And Una's lead author on our peer support implementation paper. And I'd like to introduce Lizzie, who's a lived experience researcher at the Pro, who's also received peer support and trained and worked as a peer support worker. And Una and Lizzie are going to present on peer support implementation, barriers, and facilitators. Over to you.
Thank you so much, Andrew. That's a much nicer introduction than I would give myself, so I really appreciate that. And thank you so much for everyone who has come along. It's really amazing to see so many people interested in peer support, but also to see some familiar names as well. So some of what you're going to see today is hot off the press, some of our findings from an interview study that we did about a year and a half ago. I suppose we were talking to people, and I just noticed there's a few people who've already put in the chat, oh, I know your name from that. So it's really lovely to see people who are interested and want to know what we find. And a lot of what we're going to talk about today may reflect some of what Karen and Ruth have just talked about, but I suppose just to put in context, this interview study was done kind of last year, 2023 to 2024. So it's a snapshot in time of more recent kind of history. So I think just marking on from Simon's question, I suppose this is a snapshot of the time right now as people provide peer support post-pandemic in the 2020s, so to speak. So I'm going to bring you through some of this, but I'm also alongside the wonderful Lizzie, who's already been introduced. But I wonder, Lizzie, if you want to just wave and say hello to everyone before we get going.
Sure. Hi everyone, I'm Lizzie. Like Andrew and Una said, I work at the Pro as a lived experience researcher, so supporting researchers with their research that they're doing from the lived experience lens. I was particularly interested in peer support because when I was struggling with my mental health as a teenager, I had a peer support worker and that really helped me. And I also trained as one with IMROC a few years ago as well. So kind of got both sides. So yeah, I'll let Una introduce us today and then come back with a bit more.
Amazing. And I want to just put it out there that myself and Lizzie were involved in this study with a number of other colleagues who you will be able to see if we have the link in the chat to our paper, but there are lots more people who have actually done all the hard work in this. So we may be taking the credit today, but thank you to all of our team who actually did all of the hard work and the people that you might have remembered if you did take part in the study. So just some of the little bits of background just before we get going. What we're presenting today is work from the Policy Research Unit in Mental Health, and our views and what we're presenting today are not those of our funders. So do keep that in mind. And also some of these findings haven't been published or peer reviewed. So if you could not share pictures over X or TikTok or whatever the social media is these days, the old dinosaur Una speaking. But if you could keep it just to yourselves, that would be perfect, not to share it too far. But do look at the preprint because it is hot off the press and only came out on Friday. So I'm going to hand over to Lizzie, who's going to start us off.
Sure. So as Karen and Ruth said, a lot of this, so I'll just kind of go through it briefly. Peer support workers are employed to draw on their lived experiences to support mental health service users or carers. So it's got a different approach to clinicians who maybe work through more medical and clinical models. I'd say the training for being a peer support worker was very much about mutuality, reciprocity, really trying to utilize your experience to connect with the other person, which might be different from other approaches. It is recommended in policy guidance internationally. However, it's not that well implemented. It is starting to be rolled out more, which was obviously the purpose of these papers, just to see kind of what's out there at the moment and how we can build on it. But it's sadly not everywhere. There are lots and lots of reviews that have been conducted. However, there's a lack of research exploring the peer support work role itself and the experiences of individual peer support workers, which, as we'll go on to say, were very, very different, both across different services, across different locations. Everyone seemed to have a different experience, and I think that's what this review was really trying to draw out. Really trying to hear the peer support workers' voices to see how that would then affect implementation.
Let me
So based on that, the aims of the study were simply to develop an understanding of roles and experiences of peer support workers across the wider mental health system, including third sector services. So like we said, it is starting to be rolled out more in the NHS. But prior to this, it was mainly charity based and those third sector organisations. So we really wanted to kind of get a view of all of them really, rather than just focusing on the NHS.
Perfect. And as a researcher, I'm going to take on the methods because I like the boring bits, but we'll try to keep this kind of quite low key. So basically what we did is we interviewed peer support workers who were in paid peer support roles across England. As a Northern Irish woman, I recognise that how we do peer support work is important in the developed nations, but there are differences in how kind of policies are laid out. So we thought we'd keep to England, and we talked to 35 people who were in these roles. And thank you to all of those people anywhere here. Thank you so much. There were incredibly rich interviews that were conducted on the most part by our lived experience researchers. I think one or two people were stuck with me, but on the most part, all of these interviews were conducted by our lived experience researchers who have kind of that shared experience of having mental health distress themselves. So that kind of almost peer support, kind of peerness followed through in our research. Most of our participants were from white ethnic backgrounds, most were female, and varied in different ages. As Lizzie's already alluded to, we had quite a lot of differences within kind of our population and also the kind of services people worked in. So 21 of our participants worked in NHS, but we also had people who were working in the third sector and community-based organisations and paid peer support roles, or people who were working on self-employed basis. So a wide range of different experiences, and it came in lots of different kind of experiences and types of people who were involved, including people who were working in kind of low-banded peer support roles up to people who were working managerial roles. So we had a wide range of different types of roles that were also take part. I think you'll hear a little bit more about that with Tasha after us. The type of services that were included, this is what really surprised me and really interested me, was that we had lots of different types of services. So we had not just kind of acute mental health care, but we had kind of people from specialties like eating disorders, maternal mental health, inpatient services, people working in specialist organizations where it was early intervention and psychosis, veterans, student services, everything you can imagine. Peer support is in all of these different services. So we were looking at the barriers and facilitators to all these different things. There's lots of commonality, but there are also some differences. So you will need to look into the paper to see some of those, but we're going to touch on some of our key themes, and I'm going to hand over to Lizzie for that.
Sure. So the themes, there was so much data that came out of them, as you'd expect. And we wanted to try and simplify them. We spent a lot of time going around in circles about how we could organise the themes and how they would look, but eventually we came up with this. So we had, I'll go from bottom to top because for me that makes slightly more sense. So A was the micro level. So this was actually doing the work. So this was starting with the individual and the peer support worker doing the work with the individual service user that they were working with. And here we had 3 different themes, which were striking the balance, having a shared connection with service users, and then being open about your experience and being boundaried. So we'll come on to some of these themes on the next few slides. Secondly was the Meso level. So this was working with the organisation. So we kind of saw this as like the middle ground. So not quite with the individual and the service, but the one in between. So in your individual team, in your individual trust. And there were 3 themes there around the importance of good support and supervision, the impact of the wider team, and the kind of ethos of peer support amongst the team you're in and how much that affected the role. And then the heterogeneous nature of the peer support role. So there was a lot of talk around peer support being very ambiguous, people not really knowing what it was, and peers kind of being left to almost define and defend the role for themselves. And then C, we have the macro level. So this was thinking beyond the workplace. So the more systemic factors. So coming into this was things like funding and resources, pay and progression, and the complex mental health systems in general, and kind of peer workers trying to have to find their place in there. So firstly, I'll go back to the micro level. So this was doing the work with the individual, like I said. So participants spoke about the core values and unique elements that made the peer support role different to their non-lived experience colleagues. So it was very much around, they kind of worked to set principles rather than frameworks. So I don't know, CBT therapists maybe have their certain set session structures, whereas peer support was a lot more flexible, using principles, like I said, of mutuality and reciprocity and respect and things like that. And with that, created a lot of flexibility. So they could kind of define the role for themselves and define the work that they did with the person. So this could range from, I don't know, doing, sitting in a room and having a chat with them, to really practical stuff like, going shopping, doing cooking, budgeting, all that side of things. They had a lot more freedom to kind of go out in the community and do that practical work as well. Secondly was the unique element of using their lived experience to be a bridge between clinical colleagues and service users. So kind of seeing them as almost like an in-between. So obviously not a service user, not a clinician, but someone who can kind of see it from both sides. And I think that was really valuable, both for the individual, having someone who could act like an advocate and understand them, but also for clinical colleagues who maybe hadn't experienced their mental health struggling in whatever field they were working with, say eating disorders. For any clinicians who hadn't had an eating disorder, the peer support workers may be able to kind of explain and develop their understanding in a way that other clinicians might not be able to do. And then thirdly was the personal qualities and considerations needed to deliver this. So a big role around boundaries. Obviously a core part of being a peer support worker is sharing your lived experience, but how much do you share? When is it relevant? What are the kind of parameters around that? And peer support workers really having to navigate that for themselves on an individual basis, and how that could vary a lot between different service users and different mental illnesses as well. Secondly, we have the Meso level, so working within the organisation. So thinking about the team that you're working within, and how this was so different. I think it was really recognised that peer support doesn't operate in a vacuum. It's really important to consider the people they're working with, so the other clinicians, other staffs, I guess, knowledge, experience, and thoughts around peer support. Really important, the support they receive from managers and colleagues, as well as connections with other team members. I think this varied so widely. We had some interviewees whose services were really good and really advocated for peer support, and it was very much like a top-down approach. And then other people feeling like they were left on their own. No one in their team knew what peer support work was. Their manager didn't really have an understanding of it. They didn't have any supervision, and it was quite a lonely, isolating experience for them. So yeah, the role of the team very much defined how peer support workers felt about their role. And then feeling valued as well was a big one. And maybe people felt like they were there, they were getting paid to be there, but no one really cared about them or their role. They weren't necessarily given a seat at the table for things like ward rounds or care plan reviews or anything like that. And some of them almost felt like sidelined or ostracated from the rest of the team. So yeah, that was that theme. I'll hand over to Una to talk about the wider factors.
Well, I think the macro level, looking beyond that workplace and the systemic factors, are things that we've already touched on in the review, and it will come as no surprise to anyone who works in peer support and in mental health more widely. It was acknowledged by many participants that while they could be all the facilitators there for actually doing the work and having a great team around them, that often there could be barriers and challenges whenever it came to those kind of more policy-driven things and systemic issues. So things around funding, pay, job instability, lack of career progression came up for the majority of participants. It wasn't always an issue for people. There were some people who we talked to who actually had great career progression or felt that they were paid as an equivalent, or that pay wasn't as big an issue. So that it's not universal that everyone is complaining about pay and career progression, but it certainly came up more than it didn't, if that makes sense. And certainly looking at those more structural factors, I suppose using the words that Lizzie used of having a seat at the table when it comes to that policy level and at the more structural side of things. And I guess that's what is really good about this kind of work and being able to present to a lot of people today, is that actually being heard and having a seat at the table to policy people and to those who have the purse strings is really important, to show that these are the factors and issues that may see as people, so that they can be challenged and looked at better. So in conclusion, what we find is that peer support was highly valued by peer workers, by service users, by staff across a number of mental health services, and that actually there's been an explosion of peer support across a range of services that when I was working in more peer support services 20 years ago, even though I'm sure I don't look at, they didn't exist. Those roles didn't happen kind of 20 years ago for a lot of us. So to see the expansion is incredible, and to see the people who are so passionate and working flexibility with person-centered approaches, but also with boundaries that mean you're not just kind of working in this free-for-all is great. And there are positive cultures out there that we can learn from, and see where those barriers and facilitators can help us progress a little bit further, if we say. I'm going to just give back to Lizzie just to give her personal reflections, as she did a lot more of the work than I did. As a final thought.
That is absolutely a lie. I think you did most of the work on this project, especially writing the paper and all the revisions and drafts. But yeah, just some personal reflections. I think I really enjoyed being involved in this project and interviewing the different peer support workers. I think, like I said before, peer support workers don't operate in a vacuum, but sometimes it feels like you do. When I worked in my peer support role, I was the only peer support worker in my team. It was very new. It was very much trying to carve out the role and defend it and justify yourself. And hearing the range of peer support workers' experiences, I think it really highlighted the need for change and kind of the need for it to be taken seriously, and for it to be rolled out more, because the impacts were huge. And I think the whole profession relies on the compassion and the passion for peer support workers having their own lived experience and really caring enough to kind of go into it and use that. But that's not going to, be sustainable without the pay and the career progression being reviewed. So yeah, really interesting project. And thank you to Una and everyone else for involving me.